Hello friends, welcome back to Learning Nails and Aesthetics. Today we are doing the chapter glossary. Chapter 4, Disorders, Diseases of the Skin in the Milady Esthetics book. Check out my other videos and the Milady Nails book as well as the Milady Foundations book. We are starting on chapter 150, it's page 156. Chapter 4, Disorders and Diseases of the Skin. Keep in mind, I am not AI, so mistakes will be made. You can just laugh along with me. We will learn this together. Have a coffee, and let's do this. Acne. Chronic inflammatory skin disorder of the sebaceous glands that is characterized by comedones and blemishes, commonly known as acne simplex or acne vulgaris. Actinic keratosis, see, not AI. Pink or flesh-colored precancerous lesions that feel sharp or rough result from sun damage. Albinism, absence of melanin pigment in the body, including skin, hair, and eyes. The technical term for albinism is congenital leukoderma or congenital hypopigmentation. Anhidrosis, deficiency in perspiration, often a result of a fever or skin disease that requires medical treatment. Atopic dermatitis, excess inflammation, dry skin, redness, and itching from allergies and irritants. Basal cell carcinoma, most common and least severe type of skin cancer, which often appears as light, pearly nodules. Characteristics include sores, reddish patches, or smooth growth with an elevated border. Body dysmorphic disorder, psychological disorder in which the client has a preoccupation with their appearance. They tend to fixate on minor appearance imperfections and see them as disfiguring. Bromidrosis, foul-smelling perspiration, usually in the armpits or on the feet. And something comical that helps me remember this is if something's stinky or someone is stinky, you'd be like, ew, bro. So it's bromidrosis. Haha. You'll never forget that one. Bulla, large blister containing watery fluid similar to a vesicle but larger. Carbuncle, cluster of boils, large inflammation of the subcutaneous tissue caused by Staphylococci bacterium, similar to a furuncle, which is a boil, but larger. Comedo, plural, comedones, mass of hardened sebum and skin cells in a hair follicle. An open comedo or blackhead when open and exposed to oxygen. Closed comedones are whiteheads that are blocked and do not have a follicular opening. Comedogenic. Oh my goodness. Comedogenic. Maybe I need more coffee. Tendency for an ingredient to clog follicles and causes buildup of dead skin cells, resulting in comedones, blackheads. Conjunctivitis, tendency for an ingredient. What am I doing? I'm reading the previous. Okay, sorry. Conjunctivitis, also known as pink eye, very contagious infection of the mucous membranes around the eye, chemical, bacterial, or viral causes. So avoid touching your eyes when possible, and if you wash your hands frequently, you should be good to go. However, when my kids were little, they sneeze in your face and stuff. I did get pink eye that way a couple times. Contact dermatitis, also known as dermatitis venenata, inflammatory skin condition caused by contact with a substance or chemical, Occupational disorders from ingredients in cosmetics and chemical solutions can cause contact dermatitis. Allergic contact dermatitis is from exposure to allergens. Irritant contact dermatitis is from exposure to irritants. Crust, dead skin cells form over a wound or blemish while it is healing, resulting in an accumulation of sebum and pus, sometimes mixed with epidermal material. An example is the scab on a sore. Cyst, closed, abnormal, developed sac containing fluid, infection, or other matter above or below the skin. Drink your coffee. Dermatillomania, a form of obsessive compulsive disorder in which the person picks at their skin to the point of injury, infection, or scarring. A person with dermatillomania finds the picking stress relieving and not painful. It can often be socially isolating because severe dermatillomania can be disfiguring. Dermatitis, an inflammatory condition of the skin, various forms of lesions such as eczema, vesicles, or papules. The four main categories are atopic, contact, this word always gives me trouble. Seborrheic, and I know that's not right, I'm sorry. Dermatitis and status dermatitis. Seborrheic, I'm going to have to work on that. Dermatologist, a physician who specializes in diseases and disorders of the skin, hair, and nails. Dermatology, medical branch of science that deals with the study of skin and its nature, structure, functions, diseases, and treatment. Diaphoresis, excessive perspiration due to medical condition. Diaphoresis, excessive perspiration due to a medical condition. Eczema, inflammatory, painful itching disease of the skin, acute or chronic in nature with dry or moist lesions. Clients with this condition should be referred to a physician. Oh gosh, here's that word again. Seborrheic dermatitis, mainly affecting oily areas, is a common form of eczema. Edema, swelling caused by a fluid imbalance in cells or a response to injury or infection. Ephelids, also known as freckles, are tiny, round, or oval pigmented areas of skin on areas exposed to the sun, also referred to as macules. They are small, flat, colored spots on the skin. Erythema, redness caused by inflammation. A red lesion is erythemic. Don't you love my unfinished nails? I was experimenting. A client wanted her nails done a specific way for a wedding. This was significantly longer and I had to cut the end off, but it had a little more decoration than you see now. Back to work. Excoriation, skin sore or abrasion produced by scratching or scraping. Fissure, crack in the skin that penetrates the dermis, chapped lips or hands, or fissures. Folliculitis, also known as folliculitis barbae, psychosis barbae or barber's itch, inflammation of the hair follicle caused by a bacterial infection from ingrown hairs. The cause is typically from ingrown hairs due to shaving or other epilation methods. For some reason, all I could think of was mountains after that, like Appalachian mountains. That's crazy. I do need more coffee. Furuncle, more coffee, also known as a boil or a subcutaneous abscess filled with pus. Furuncles are caused by bacteria in the glands or hair follicles. Herpes simplex virus 1, Strain of the herpes virus that causes fever, blisters, or cold sores. It is a reoccurring contagious viral infection consisting of a vesicle or a group of vesicles on a red swollen base. The blisters usually appear on the lips or nostrils. Herpes simplex virus 2, strain of the herpes virus that infects the genitals. Herpes zoster, also known as shingles, a painful viral infection, skin condition from the chickenpox virus, characterized by groups of blisters that form a rash in a ring or line. Hyperhidrosis, excessive perspiration, not related to excessive exercise or heat. So again, same with the bro one we did a minute ago. The hyperhidrosis, anything, hyper is excessive. So when the hydrosis is related to not necessarily water, but moisture, I guess, is an umbrella way to say it. So hyperhidrosis, excessive perspiration, not related to excessive exercise or heat. Hyperkeratosis, thickening of the skin caused by a mass of keratinized cells, keratinocytes. Hyperpigmentation, overproduction of pigment. Hiccups. Hypertrophy, abnormal growth of the skin. Many are benign or harmless. Hypopigmentation, absence of pigment resulting in light or white splotches. So if you haven't figured it out already, hyper means a lot of something, and hypo means, I guess, the absence, lack of, less than something. I don't think it would be, like this one says, absence of pigment. But I guess hypo could also be less than what they consider to be average, or using the term loosely, normal. That'll help you figure out what a lot of medical terminology, well, not necessarily medical, but what a lot of this terminology means is knowing the meaning of the word parts. And this was an easy example of that. Impetigo, a contagious skin infection caused by staphylococcal or streptococcal bacteria. Yeah, just when I start to sound like I know what I'm talking about, I can't pronounce words. Characterized by clusters of small blisters or crusty lesions, and often occurring in children. Keloid, thick scar resulting from excessive growth of fibrous tissue. Collagen. Fibrous tissue is collagen. Keratoma, acquired, superficial, thickened patch of epidermis. A callus is a keratoma, caused by continued, repeated pressure or friction on any part of the skin, especially the hands and feet. Keratosis, plural, keratoses, abnormally thick buildup of cells. Keratosis pilaris, redness and bumpiness common on the cheeks or upper arms. It is caused by blocked hair follicles, and patches of irritation are accompanied by a rough texture and small pinpoint white milia. Lentigo, freckles, small yellow, brown colored spots. Lentigens, that result from sunlight exposure. Or actinic or solar lentigo patches are referred to as large macules. Lesions, mark, wound, or abnormality, structural changes in tissues caused by damage or injury. Leukoderma, skin disorder characterized by light, abnormal patches caused by congenital, acquired, post-inflammation, or other causes that destroy pigment-producing cells. Vitiligo and albinism are leukodermas. Macule, plural maculae, flat spot or discoloration of the skin, such as a freckle. Macules are neither raised nor sunken. Milia, epidermal cysts, small, firm papules with no visible opening, whitish, pearl-like masses of sebum, and dead skin cells under the skin. Milia are more common in dry skin types and may form after skin trauma, such as laser resurfacing. I would like to add that milia, you can help prevent milia by when you're washing your face or applying products if you go in small circles. If you are just going back and forth, you're kind of like buttering it up, I guess, like causing a layer to form. I hope that makes sense. I will try to think of a better way to explain it in another video. Miliaria rubra. Miliaria rubra. Also known as prickly heat. Acute inflammatory disorder of the sweat glands, resulting in eruption of red vesicles and burning. Itching skin from excessive heat exposure. Malignant melanoma, most serious form of skin cancer as it can spread quickly, which means it metastasizes. Black or dark patches on the skin are usually uneven in texture, jagged, or raised. Melanomas may have a surface crust or bleed. Mole, pigmented nevus, a brownish spot ranging in color from tan to bluish black. Some are flat, resembling freckles. Others are raised and darker. Nevus, also known as birthmark, malformation of the skin due to abnormal pigmentation or dilated capillaries. Nodules, also referred to as tumors, but nodules are smaller bumps caused by conditions such as scar tissue, fatty deposits, or infections. Achymicosis, a fungal infection that produces symptoms of thick, brittle, discolored nails. The fungus lives off the keratin in the nails. Papule, pimple, small elevation on the skin that contains no fluid but may develop pus. Perioral dermatitis, acne-like condition around the mouth. These are mainly small clusters of papules that could be caused by toothpaste or products used on the face. Phyllosebaceous unit, the hair unit that contains the hair follicles and appendages, the hair root, hair bulb, dermal papilla, sebaceous appendage, and erector pili muscle. Poikiloderma ovsavant, a skin condition caused by actinic bronzing, chronic sun exposure, to the sides of the face and neck. The skin turns a reddish-brown hue with a distinct white patch under the chin. It's benign, meaning it is not cancerous. Polycystic ovarian syndrome, PCOS, often shortened and pronounced PCOS, is a hormonal condition that impacts women in childbearing years believed to have a genetic component. PCOS symptoms include acne, thinning hair in a male hair growth pattern of baldness, such as sparse hair density at the front and top of the scalp. It also causes abnormal hair growth on the face, arms, thighs, neck, and breasts. Post-inflammatory hyperpigmentation, abbreviated PIH, darkened pigmentation due to an injury to the skin or the residual healing of an acne lesion. After an acne lesion has resolved, often deep red purple or brown in appearance. Primary lesions. Primary lesions are characterized by flat, non-palpable changes in skin colors, such as macules or patches, or an elevation formed by fluid in a cavity, such as vesicles, bullae, or pustules. Pruritus, persistent itching. Sorry, I'm knocking stuff off the table. Pseudofolliculitis, also known as razor bumps, resembles folliculitis without the pus or infection. Psoriasis, skin disease characterized by red patches covered with white silver scales caused by an overproliferation of skin cells that replicate too fast. Immune dysfunction could be the cause, usually found in patches on the scalp. Elbows, knees, chest, and lower back. Pustule, raised, inflamed papule with a white or yellow center containing pus in the top of the lesion, referred to as the head of the pimple. Retention hyperkeratosis, hereditary factor in which dead skin cells build up and do not shed from the follicles as they do on normal skin. Scale, flaky skin cells, any thin plate of epidermal flakes, dry or oily. An example is abnormal or excessive dandruff. Scar, light-colored, slightly raised mark on the skin, formed after an injury or lesion of the skin has healed up. The skin hardens to heal the injury. Elevated scars are hypertrophic. A keloid is a hypertrophic abnormal scar. Sebaceous filaments, similar to open comedones. These are mainly solidified impactions of oil without the cell matter. Sebaceous hyperplasia. Benign lesions frequently seen in oilier areas of the face. An overgrowth of the sebaceous gland that appears similar to open comedones, often donut-shaped with sebaceous material in the center. Seborrhea, severe oiliness of the skin, an abnormal secretion from the sebaceous glands. Seborrheic, that just doesn't flow very well, does it? Seborrheic. Dermatitis, a common form of eczema, mainly affects oily areas, characterized by inflammation, scaling, and or itching. Secondary lesions, skin damage developed in the later stages of disease that changes the structure of tissues or organs. Skin tag, small, benign outgrowth or extension of the skin that looks like a flap, common under the arms or on the neck. Squamous cell carcinoma, type of skin cancer more serious than basal cell carcinoma, characterized by scaly red or pink papules or nodules, also appear as open sores or crusty areas, can grow and spread in the body. Stasis dermatitis, chronic inflammation state in the legs due to poor circulation. The legs may sometimes have ulcerations along with scaly skin, itching, and hyperpigmentation. Sensitization, the development of hypersensitivity due to repeated exposure to an allergen that can take months or years to develop due to the allergen and intensity of exposure. Steatoma, sebaceous cysts or sebaceous tumor filled with sebum, ranges in size from a pea to an orange, usually appears on the scalp, neck, and back, also called a wen, spelled W-E-N. Tan, increase in pigmentation due to the melanin production that results from exposure to UV radiation. Visible skin damage, melanin is designed to help protect the skin from the sun's UV radiation. Tinea, contagious condition caused by fungal infection, not a parasite, characterized by itching, scales, and sometimes painful lesions. I'm drinking the coffee, it's getting cold. Tinea corpus, also known as ringworm, a contagious infection that forms a ringed red pattern with elevated edges. Tinea versicolor, what? That can't be right. Versicolor, also called Pityriasis versicolor is a fungal condition that inhibits melanin production. It is not contagious because it is caused by yeast, a normal part of the human skin. It is characterized by white, brown, or salmon-colored flaky patches. Tubercle. Tubercle. Abnormal rounded solid lump, larger than a papule. Tumor, large nodule, an abnormal cell mass resulting from excessive skin multiplication, varies in skin size, shape, and color. Ulcer, open lesion on the skin from open lesion on the skin or mucous membrane of the body, accompanied by pus and loss of skin depth. A deep erosion, a depression in the skin, normally due to infection or cancer. Urticaria, also known as hives, caused by an allergic reaction from the body's histamine production. Varicose veins, vascular lesions, dilated and twisted veins, mostly in the legs. Vasodilation, vascular dilation of the blood vessels. Verruca, also known as a wart, hypertrophy of the papillae and epidermis caused by a virus, infectious and contagious. I think I need to have more coffee before I start instead of trying to drink the coffee during. Vesicle, small blister or sac containing a clear fluid. Poison ivy and poison oak produce vesicles. Vitiligo, pigmentation disease characterized by white patches on the skin from lack of pigment, made worse by sunlight. Wheal, this one is spelled W-H-E-A-L. Itchy, swollen lesion caused by a blow, insect bite, skin allergy reaction, or stings. Hives and mosquito bites are wheals. Hives can be caused by exposure to allergens used in products. I do go over these words before we do this, and I can pronounce them, but then I go back to read it again later, and it's just all messed up in my head. I guess because I don't commonly use these words. So, that you use it or lose it, I guess, So, okay, that is the end of the chapter 4 glossary, disorders and diseases of the skin. In the next video, we will start chapter 5, skin analysis. So, please comment, like, share, and subscribe, and check out my other videos. I also have unboxing and other books as well. I appreciate you listening. I hope this was helpful to you. Have a great day. Thanks. Bye.